Thank you, Mark. It's now my pleasure to introduce Lori Dorfman, who directs the Berkeley Media Studies Group, a project of the Public Health Institute. The Berkeley Media Studies Group works with advocates to build capacity to use media advocacy in confrontational policy environments. I'm trying to think of non-confrontational policy environments. So they can focus attention on transforming systems and structures to foster health. With colleagues at the Center for Science in the Public Interest, she co-convenes the Food Marketing Work Group, which is a national network dedicated to eliminating harmful food marketing by actively identifying, investigating, and advocating changes to marketing practices that undermine health. Please join me in welcoming Lori Dorfman.
Good morning, everybody. I'm going to take up where Mark left off. He talked about that 10%, and I'm really going to focus more on that 70% of what benefits population health or could improve population health in the environment. So that was the right segue for me, Mark. I want to do three things. Let me get my little clicker here for you. Let's see, I'm looking at the last slide in my talk instead of the first one, so maybe you guys will fix that for me. I'm going to do three things for you. I want to talk about communications and use that as a lens to think about improving population health and make 3 points, really. The first point I want to make is that despite the fact that we're talking about communications, it doesn't come first. Strategy dictates communication, not the other way around. So I'll say a little bit about that. I also want to talk about how education, although it's our first impulse, if we could just figure out what to say to people and do it in the right way, they would do the right thing. We're challenged by the zip codes that Alan and Mark both refer to and the environments that surround people. So education doesn't go as far as we want because the environmental factors that influence health are so strong. So that's the second thing I want to do. And then I want to make an argument that we should be using communications to change those environments. And to do that, we have to challenge the dominant narrative, the story that we tell ourselves about health. And we have multiple stories floating around, and I'm going to compare a couple of them, and then we can talk about that a little bit more in our discussion. And so that's where I'm going to head off. And so I want to start by inviting you into my office in Berkeley, California. And here's the reception area. And I want to show you that poster on the wall. I don't know if you can you see it from there, but that's Alice in Wonderland. And she's talking to the Cheshire Cat. And here's the conversation that Alice has with the Cheshire Cat. She said, "Would you tell me, please, which way I ought to go from here?" "Well, that depends a good deal on where you want to go to," said the cat. "Well, I don't much care where," said Alice. "Then it doesn't matter which way you go," said the cat. "Oh, so long as I get somewhere," said Alice, as an explanation. "Oh, you're sure to do that," said the cat, "if only you walk long enough." So this is just a reminder that message isn't first when we're talking about communications. That we have to know first what we want to change in the world. And we have to know how we're going to change it. That gets to Alan's comment. He doesn't know of any non-confrontational policy situation. So you have to know how are you going to change what you're going to change in the world? And then you also have to say why you want it changed. This is important because if engagement is our theme here, that's where people engage. My training is in public health, and in public health we get very heady. We're good at numbers. We show a lot of detail about that because we need the science to inform what we should do next. And we spend a lot of time talking about that. But except in a room like this, it's very hard to get people to engage at that level. What we have to go back to is why we entered this room and this field in the first place. Why do we care about health? And we have to express that and say that out loud to each other and in forums outside this room, because that's the place where people connect. And we sometimes forget that. So what we tend to do is think if we could just do a little bit more education. So here you have one problem with education. This is outside an intensive care, probably surgery. We see the doctor talking to the patient. Looks like she's grieving. She has a tear-stained face and a hanky, and the doctor says, "I was able to get in one last lecture about diet and exercise." So it just doesn't go as far as we want it to. And the reason it doesn't is because the environment matters. I'm showing you a food environment here. There could be lots of different environments. And when when we're engaged in those environments, we can't really compete from a health perspective. We don't have the same level of resources, and we're not offering the same kind of benefits. Here's what happens when we try to compete. And here you see two billboards on the side of a home, let me say. Not everybody has billboards on their homes. Think about the different environments different communities live in. And we have at the top the California Health Department trying to warn us that obesity is very serious, very important, don't take it lightly. And we have a physician delivering this message. Messenger's always very important. And below it, we have McDonald's telling us how to be happy. So which of these women's advice do you want to follow? So we simply can't compete. So we have to think of other strategies. It's not that education's not important. We have to do education. But it can't be the only thing we do. And we have to think about who we're educating about what. So when you think about how communications works in public health, there's generally speaking a focus, I've called it up there, brand X media. This is information campaigns or social marketing campaigns. The idea is that people want to use communications to help individuals become healthier. And the way they do that is by using the communications to warn them about a danger or inform them about something they ought to do to make themselves healthier. And we do focus groups to figure that out and lots of formative research, and that really helps us track the language and get to the things that people will understand so they will make a personal change in their behavior so that they will become healthier. The idea is to create a message, the right message that gets to the right person at the right time so they do the right thing to improve their health. And if we do that, and we do that well, all these different individuals will sum to a population that's healthier. The assumption underlying this idea about communications in public health is that we have an information gap. That if what people need to be healthier is a lack of information, if we fill that gap, then they will be healthier. And you know, this works sometimes and for some people. I wasn't the only one walking around the lake this morning in the village, because some of us know that if we exercise, you know, if we just break a sweat once a day, we're going to live longer, healthier lives. Now, some of us also know, including me, that it would have been better to wake up early enough to walk around twice instead of once. It really wasn't that big a lake. But that information wasn't enough to motivate me this morning to get out of bed. So information is necessary, but not sufficient for the level of population change that we need if we want a healthier society. So what do we need to do? We need to take communications to the next level. And the reason the slide says whose behavior is because on the left side, we're talking about individuals. On the right side, we're talking about whole societies, whole communities. We're focused not on individuals, but on issues. We want to use media to pressure decision makers so they will make the decisions that change those institutions and change communities in the way that a whole population can be healthy. And we want to use communications to mobilize the people who can affect the decision makers. The idea here isn't personal change, but policy change. Generally speaking, the reason it's policy, it doesn't have to be policy, but the reason it's policy is because that's how, generally speaking, as a society, we set our structures and systems in place. It's how we make the rules, whether that's in a family, a community, or the local, state, and federal government, as Alan said. That's what we say is acceptable and not acceptable. So that's our proxy for making the kinds of social norm and environmental changes that are going to do that 70% of change we need to see environments that support health and foster health rather than diminish health. That means we're using communications not to deliver a message, but to help people raise their voices. The assumption underlying this is that we have a power gap, not an information gap, that some in our society have less say over what those environments are like and need to become engaged in the rulemaking about those environments. And the reason I say whose behavior is because on the left side we're talking about individuals making good decisions for their health, like I should have this morning and walked twice around that lake. On the right side, we're thinking not about consumers, but of citizens. We're talking about civic engagement. We're talking about the communication being about engaging us as a society in creating healthier environments. And the reason that is hard to do, partly, is because of the story that we tell each other about health. So I want to talk to you about that just a little bit. And some people call this framing, and it's how things are framed. And some people these days talk about narratives and stories. The label isn't so important. What's important is that people have ideas in their heads, that their brains do the work for them before the rationality part of our brain kicks in. And we carry those stories around, and they help us interpret what we see. And if in public health we want people to see the environment, not just the portrait of individuals who need help with their health, but the landscape of a whole community that needs to change, or a whole institution, we have to understand what people are coming to already with in their heads, if that made sense. Okay, so look at this orange box and tell me, what does it say behind the box? By the way, this is the audience engagement part of the talk. Okay, all right, so what does it say? Oh, say it loud, say it proud. Okay, except, not so much. Look what you did. Oh my goodness. Didn't say that at all. Isn't that funny? Okay, look what your brains did. Your brains took a tiny little Q, just the top of a letter, and filled in the blank. You didn't say brain, what does that say? You shouted out, healthy Colorado. You were wrong. Whoops, you were wrong in this case. Whoops, let me go forward again. Okay, but that's what your brain did. And your brain does that with stories as well, and ideas as well. And the more you hear ideas, the easier it is for your brain to bring them up. And if there are competing ideas, it's hard for your brain to see. Isn't that fun? I took this off a food company website. I was trolling around on the internet one day, and I found this thing, and it said, kids in technology against this blog. I went, oh my goodness, I can use that. And it works in every audience. I got to tell you, I change the words all the time. Okay, so I want to tell you about the stories that are in our heads, and there's many stories. Two competing stories about childhood obesity, just as an example. One might be called, "You are what you eat." And that story has to do with the fact that parents aren't paying attention to what their kids eat, and they could be doing a much better job. And that's instilling bad habits, and families and children are then making bad personal choices. Or that's combined with the fact that they're paying attention to their little devices, and their thumbs are overactive and they're not out running around, and so they have underactive legs. And that we need more exercise, and we need to exercise willpower. And if we do that, we can solve this problem. And that's one story that is widely circulating around childhood obesity. It's not the only story, however. Another way to understand this issue is by recognizing that what surrounds us shapes us. That story has to do with junk food marketing, as just one example that I showed you a minute ago. It has to do with whether neighborhoods are connected, whether there's transportation, whether there's recreation, whether there are well-lit parks and programs where kids can interact with adults, or whether it's a neighborhood where there are lots of broken fences, loose dogs, and children are afraid to go outside and play. It's a story that asks whether there's physical activity in school and time for that, and whether the local, state, and federal policies are in line with what we want for a healthy community. Now, both of these sides can be true at once, and both of them are true at once. The question is, are we helping people see a broader picture? Right now, unless we cue it up, unless we help frame the environment and help people see a piece of the landscape, They will focus only on the individual. It is, as a nation, it's our starting point for understanding anything, including social problems and health problems. It goes to the individual. It's our job, I think, in public health to expand that frame so people see individuals embedded in landscapes and are able to tell those stories. Because otherwise we end up with stories like this on the cover of the New Yorker, where we have people in stocks for smoking or eating too much salt or too many carbs. We're really good at pointing the finger. We have to get better at shifting and reframing. So if you look at the scale, you see I have two things on this scale: personal responsibility and institutional accountability. And this is not either or. This is both and. But we are, as a society, out of balance in the way we tell stories about these two things. We know this because at the Berkeley Media Studies Group, we study news coverage of all kinds of different public health issues, as many other organizations have. And when you query news stories, we study news stories because we know that's the starting point for most people's conversation, especially policymakers. And if they want to have, if advocates want to have a conversation with policymakers, they need to know what that starting point is. The news helps us understand what that is and what the continuum of debate is. That's why, as public health people, we became interested in the news. So when we study the news, our basic question is, at the end of the day, where does this news story assign responsibility for this problem? And does it assign responsibility at the foot of an individual, or does it have an understanding of a shared responsibility between individuals and institutions? Now, if you do this kind of research, the first thing you will find is, if you ask that question of every news story, every health news story that we've examined, at the end of the day, you will have two piles. You will have some stories that emphasize personal responsibility of individuals and focus tightly in on the portrait. What's that person doing? What's the event? What's the thing that's happening in the news? And it's a very narrow frame. And so you'll have a pile of those. You'll also have a pile of stories that pull that frame out, that might start with an individual or an event as part of the story, but embeds that person in a landscape that says a little bit of something else about the conditions, some background, some context of some kind. And these are the same length news stories. It doesn't have to be more. The TV research is really clear on this, and these stories are only 1:20 long. But in 1:20, you can tell a story that embeds somebody in a landscape. The second thing you will find is that your piles will be very different sizes. That the overwhelming number of stories, 80% in television news, tell stories that stop short and just focus on individuals. That leaves us ill-equipped to help people understand what this landscape is and what is happening in the landscape, that will allow us to illustrate it for people so they will understand why that other 70% of what influences population health is important for us to address and important for us to talk about and tell stories about. We need to illustrate that landscape, and it's a vast landscape, and that circles me back to the first thing I said, which is that message is never first. So even though we need to get better at talking about the landscape, help people see that health is connected across institutions and institutional accountability matters along with personal responsibility, we have to pick something, because we can't talk about everything. So how do you pick what's in the landscape to tie to this issue? Well, we have to go back to the Cheshire Cat. We have to choose something. It has to be connected to the strategy of what we're trying to fix in the moment. And that is so hard for us in public health. I don't know about you, but most people I know in public health feel almost a moral obligation to say everything they know about an issue anytime they're asked anything about it. Yes, we must resist that urge. We must choose. We must be strategic. We can't say everything. If we say everything, we've really said nothing. And then what will happen, especially if we're talking to a reporter, is they'll pick something that we've said, and indeed we've said it, so we can't really complain about being misquoted, but it wasn't what we meant to say, or it wasn't the most important thing about what we said. We have to have some discipline about how we express what we're saying. And so we want to do some very simple things. The first thing we want to do is develop strategy. And remember that message is never first or foremost. That a lot of times what we find is that if people don't know what to say, it's because they haven't figured out what to do. So we have to know what to do, how to do it, and talk about it in a way that connects people to it. So message is never first. You have to know what you want and how to get it. That means, unlike most public health interventions where the target is the person with the problem, in this instance, if we're using communications in its most powerful form to engage policymakers, the target isn't the person with the health problem. The target is the person who can make the change, who can pull the policy lever, or the people who can put pressure on them. So that's the first thing we have to do, develop strategy and then be disciplined about that. Then the second thing we have to do is frame the debate. That means we have to illustrate that landscape. You can embed the portrait, you can still talk about the person, but where are they? What part of that context matters? Which piece of the context connects back to the strategy? I'm doing a frame here, that's why my hands keep going out. I'm taking a portrait frame. We all know, because we use word processors, portraits like this, and I'm pulling that frame out so I have a landscape. I'm now horizontal. I want to illustrate that landscape connected to the portrait, and then I want to connect the values to the solutions. Why does this matter? Is a question that we have to answer in our communications. And we have to answer it in ways that connect out broadly, not just to how it's going to benefit that person. But if we're trying to put some policy in place, and it's in place, how does that benefit the people who will never enjoy that policy? Will it? If you can explain that, then you've really pulled the frame out. I'm going to give you an example from childcare, just to pull us out of health for a second, even though we know that high quality childcare is very important to health outcomes. So imagine this sentence. If we know that high quality childcare benefits the kid who gets it, and even there's evidence about benefiting the siblings in that same household. But imagine trying to finish this sentence. You start there, quality child care benefits the kid and the family, the siblings in the house, but high quality child care even benefits people without children. After all, how would you finish that sentence? If you can finish that sentence, if you can say why the program benefits the people who aren't even going to have contact with it, then you've pulled in the values of interconnection, the things that connect us to each other, the things that make community, that don't get expressed often enough in our culture. When they do, people connect to them. Those are the values that also are deeply, deeply American. They're values that people come to this country for, along with the ones about personal responsibility. But too often, the values discussion gets left at the idea of pulling yourself up by your bootstraps. You know, that's a metaphor I don't even have to explain, right? Everybody knows what that means. Even our computers boot themselves up. They start from nothing and they become something. The metaphor runs deep. It's a good part of us, a wonderful part of us. It's what motivates me. I know as I was growing up, I was told if I applied myself, I could be anything I wanted in this world. And here I am. You know, my parents were right. I'm doing what I want. They actually don't really know what I do, but they know I'm doing what I want. So, but what about that other story? What about that story of interconnection that helps us bring the values in the communications to the fore that really help people engage? You know, you can imagine it, like think of a barn raising, right? So there's something that is a community event. You put the hot dish on the side, everybody hammers and nails, and you grunt, 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 and all together at the end of the day, there's a barn. Something where none stood before, and that couldn't have happened unless everybody came together to do it. And why Do I have to reach into the 19th century to get an image of what interconnection means to us and how important it is and how essential it is? Those are the values that we have to bring to the fore. I think it's the anthropology that Alan was talking about, and it's best at the local level and state level, like he says. Those kinds of connections that people make are important. The data and the science are important. They motivate us to choose the right policy. We want to help people understand that, but we also want to say why that matters and why that matters in a very particular context. So I encourage you to figure out what your strategy is and know what you want to do before you start talking about it. Don't spend too much time talking about the nitty-gritty details without also connecting it to the values. It doesn't mean that's the only thing you talk about. It means that when you talk about it, you make that connection. And do it strategically so that you're illustrating a specific part of the environment, a specific part of the landscape that will help people understand why the change matters. If you don't do that, if you don't cue it up for people, the way I queued up those words, Healthy Colorado for you behind the box, if you don't cue it up, they won't see it. They won't understand why you need it, because they'll think that if people just took more responsibility for themselves, we'd be a healthier Colorado. Now, that's partly true, but it's not the whole part of the story. Help them see the whole picture, and I think we'll get a lot further on that 70% and creating the environments that will really foster health in the state. Thank you very much.
Thank you, Lori. We have a break. Please write questions down on cards so we can pick them up. Pick your discovery sessions because they will fill. Don't get lost in your ping pong game and forget that we're back here in 15 minutes. See you soon. Great start. Thanks. Thanks. I am.